Hi, today I'm going to teach you all about different types of therapy. People use therapy when they're experiencing an issue that they might want to see a doctor about. Professionals are there to make sure that our brain is functioning correctly and give us a whole new toolbox of skills to excel at life. Please go to therapy. It is not embarrassing. I was just talking to my friend about this the other day. Let's say you got a broken arm, and it's going to take a little time to repair, but you just got to take care of it the right way. If you were too embarrassed to do anything about it, then your arm's going to heal all weird. Then you'll have a weird arm. Nobody wants that. So here's a basic overview of some common types of therapy. Number 1, cognitive behavioral therapy, or CBT. CBT uses specific methods to modify dysfunctional cognitive patterns, thoughts, beliefs, and behaviors. Unlike broad psychoanalysis, in which you might explore childhood trauma and so on to find the cause of the problems, CBT is a solution and action-oriented therapy. This is great for conditions like depression, anxiety, obsessive-compulsive disorder, and substance abuse. 2, dialectical behavioral therapy, or DBT. DBT emphasizes individual and group therapy to help people learn to use specific skills. This allows them to improve the way that they move through and interact with the world. DBT skills include mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. This is a great therapy for eating disorders, bipolar disorder, borderline personality disorder, and schizophrenic symptoms. 3, psychotherapy or talk therapy. This is likely what pops into your head when you think of the word therapy or counseling. Psychotherapy is a broad term for talk therapy based on working through problems, which includes things like individual, couples, and family therapy. People might pursue this type of help to deal with the loss of a loved one, grief for a recent traumatic event, and coping with the difficulties of daily life. This is clearly more general than CBT and DBT and therefore is not for serious mental health conditions or severe trauma. 4, EMDR, which stands for eye movement desensitization and reprocessing. EMDR therapy uses side-to-side eye movements or other bilateral sensory inputs such as hand tapping to aid the brain in processing traumatic memories. Harvard researchers believe the success of this therapy to be connected with the biological mechanisms involved in REM sleep, or rapid eye movement sleep, where your eyes are moving back and forth as you're processing the day's events. For many patients, this allows disturbing memories and feelings to get filed away in a more benign folder in the brain, if you will, so that they can better manage them and work through the events in other phases of therapy. EMDR is an 8-phase treatment and can be successful in treating post-traumatic stress disorder and other trauma-related issues. 5, exposure therapy. Exposure therapy can be a way for people to confront their fears instead of continuing to avoid the feared objects, activities, or situations. Psychologists work with patients to create a safe environment in which to expose them to the things that they avoid and hopefully desensitize their fear response. There are several variations and levels, some involving visualization and simulation, and others involving graded physical exposure and habit reforming. Exposure therapy has been scientifically demonstrated to be a helpful component of treatment for conditions such as panic disorder, generalized anxiety, social anxiety, and phobias. 6, somatic experiencing. Somatic experiencing therapy focuses on body sensations and body memories because trauma is stored in the body differently than normal experiences. The best way I've heard it described is like those memory marbles in the Disney Pixar movie Inside Out. So the memories are nicely rolled away into Riley's long-term memory, right? But a trauma memory would be like if you picked up one of those and threw it on the ground and shattered splinters of it everywhere. Then later, when you recall harmless memories like smells or sounds, it can trigger trauma flashbacks for seemingly no reason. This is because your brain had a hard time processing effectively while it was experiencing the trauma, so it basically got splinters of the traumatic experience in your surrounding memories. Using somatic experiencing to pick up those pieces and try to put them in the right places can be helpful for trauma, panic attacks, flashbacks, and other components of PTSD. There are other types of therapy, but these are some that you would hopefully be able to find in your community. Before making an appointment, you'll want to check online or over the phone if the place you're considering has therapists who are trained in the types of therapy that you're looking for. Therapists will often specialize in different areas and have varied training in their background, so don't be afraid to ask about the therapist's credentials and certifications during intake. There's a therapist here on YouTube who has a fantastic video on the different licensing levels of mental health professionals, from counselors to LPCs, LMFTs, LCSWs, psychologists, psychiatrists. So I will link that video down in the description. Thanks for watching. I always double check my research for you guys to make sure that I'm providing the best information possible. So I'd love it if you could press that like button and share with a friend if you appreciate the work that I'm doing. And if you have any questions about therapy or finding a therapist, do not hesitate to ask me. Have a happy, healthy rest of your week, and I will see you next time.